Hi, everyone. We have the post-lunch crowd here, so we'll promise to make this nice and entertaining and lively. So I'm Alexis Hawk, and I do work in health communications, which obviously touches on well-being, so I'm really excited to hear from our panelists. I'm going to let them introduce themselves, and why don't you all go on and share your name, your title, and then maybe one way that what you do intersects with employee well-being.
Oh, groovy. I'm Jan Goldstein. You can see I'm with Gray Media Group. We own local TV news stations across the country, also film and TV production, a movie studio, Raycom Sports. So your new favorite local TV news is CBS 46. Thank you very much. They did nail the last two winter warnings. That Jennifer Valdez was spot on, just so you know. So I'm the head of HR for our company. Some of my team members are here. My job is basically supporting them because they do the hard work. And so their well-being is the number one thing I do. But, we have very stressed out employees, 10,000 of them across the country, covering mayhem and, fires and shootings and disasters. They have to find the story. They have to shoot the story. They have to edit the story, make it in on time. It still may not get on the air. They have to look at their best while they're doing it and then get unsolicited feedback about how they looked while they were doing their job. So their well-being is extremely important to us to be able to keep them informing the public because we need facts, and we're a nonpartisan fact-delivering news organization.
Thank you so much. All right, Tiffany Clark. I am the Vice President of People Solutions and Global Wellbeing at S&P Global. So S&P Global, we provide essential intelligence to the markets of which we serve. I tell people when they're like, what is it? I'm like, the S&P 500 or Carfax. So if you've heard of any of those two brands, that's who we are. So my team is responsible for not only providing all the different people solutions, but we also provide all of the global well-being policies for our 40,000 employees that we have in 45 countries. So when we talk about well-being, particularly for our company, we're really focusing on how do we provide equitable well-being offerings to all of our employees for their different moments that matter.
Vitor Hugo Cid, I'm the head of HR in working for Philips. Philips, the medical device company, not the light bulbs and televisions and etc. We still have our brands on there, but we don't focus on the medtech outside of medtech. I can say that I'm the head of HR for one business unit. It's called Patient Care Informatics, which is focused on developing software for physicians, hospitals, and you name it. So we work on that front as well. And my work intersects with employee well-being because I'm also one of the founding members of the Juntos ERG, which is basically the Latino ERG. I'm from Brazil, by the way, living in the US for the past 8 years. And that's one area, but the other area is that also in my role as head of HR, I try to take care of my employees because you can imagine working in medtech, in healthcare, can be very stressful at times.
Excellent. Good afternoon, everyone. I'm Vaughn Miles, Siobhan Miles, Vaughn for short, and I am Global Head of Commercial Strategy and Growth for Ovia Health, which is a LabCorp-owned company. We provide end-to-end women's health and family health services, everything from preconception all the way up through to and including menopause. We have a digital app, we have health coaches, we provide guidance and education to help members to move through their women's health journey.
Hi, everyone. My name is Kayleen Gaver, and I am a co-founder and CEO at TapCheck. And TapCheck is an employee financial wellness benefit that businesses can offer their employees the ability to get paid on demand. I actually have well over 20 years of experience in the payroll industry. I've processed hundreds of thousands of paychecks in my career. But the one thing I noticed is that we were working and partnering with a lot of blue-collar industries. We were getting constant requests. I need an ad hoc check for an advance, or I need to put in loan deductions, or things like this. And the more I thought about it, I figured there has to be a better way to empower employees to access their earned wages in a very dignified way to overcome those financial obstacles. And that's really where the concept of TapCheck was born. So.
Excellent. Well, thank you all so much. And just by show of hands, can everybody hear me? Just making sure. Okay, great. Well, let's just dive right in. Since you all did those introductions, I think we can go on to sort of our second question, which is one increasingly common offering for a competitive job market is to offer, especially post-pandemic, hybrid or remote working options. That has been cited by many employees as a number one factor in where they choose to go. So, Jan, I know that when we were talking about it, you said that that can be a little tricky in your particular line of work with journalism. A lot of times you have to be there on site. So we can start with you, I guess, maybe to talk through some of the challenges that you've faced, and then maybe we can go to Vitor to talk about some possible solutions.
Groovy. Yes, sending everyone home to do the news from their living room was a lot. And look, everyone did an amazing job. It was, while my husband was outside in the driveway with the neighbors getting drunk because it was pandemic and we had nothing else to do, I was busier than I've ever been in my entire professional career. It was a model that worked for us at the time. Don't be worried about my husband, he's fine. We actually do offer addiction and alcohol support for our employees as a paid benefit if we're talking about well-being. Very challenging, and that's just not a sustainable model. That wasn't the news that we expect to deliver to the American public. So our employees just can't be remote. In our office, we have a hybrid model, so we get the time together to build these relationships that we have, and we also have time at home, which we all appreciate working remotely, where we don't get interrupted, so we can do the things we need to do all day. But for our employees, because we are competing against other workplaces that can be fully remote, it means our culture is so much more important. Every other benefit we offer becomes so much more important because, look, when you're home, you can get up and go throw in a load of laundry. You can go to your fridge and get a snack. These aren't things we can replicate. We do have good snacks. We're very good at snacks for that reason. So we have to make sure that the culture in each separate location is close, is good, right? Being on your couch with your family, with your dog, with your TV in the background, always on local broadcast news. It feels better than sometimes sitting in an office. So your office, our office, has to be close and warm. And I think we spend probably more time than you might expect just chatting with each other. You guys notice this, right? Because our relationships really, really matter. There has to be some comfort in our workplace to want to go in. That's the one thing about going in, right, is that you're connected to other people. So if you have one toxic person in that workplace, they definitely don't want to come in those 2 days they would otherwise be remote. So you have to protect that workplace and that culture the most. And then we have to look out for that in every single location across the country and make sure they know how to reach out to us if things aren't right, that they know we won't put up with them having anything less than a great environment to work in. Because they just can't work from home anymore. It just doesn't work when you're covering sports and weather and the news, or filming a movie or a TV show.
Great, thank you. And Vitor, I don't know if you want to share some of your perspective on creating some of those flexibility options, if you can.
No, of course. And at Philips, that's actually a good question because we're going through a process of change that was implemented 6 months ago with this push to return to the office. So we have a hybrid policy, 3 days in the office, 2 days working from home. But we used to have like remote workers, fully remote. Like myself, I'm remote today. And how do we balance that part is, I think, the main challenge right now. Like to keep those employees also, in a position that they can actually develop and grow in their careers. So I think that's one consideration that I would put here that is important. The other thing is like the importance of having like clear policies around this topic. So for instance, in our job catalog, we have a global job catalog, and we can identify in that job catalog what are the roles that are hybrid, what are the roles that are field, like sales, services engineers, etc., and also roles that are on-site, because we also have manufacturing. So those roles, like you cannot do it from home, like basically.
Right.
So those are some of the things that I would say it's important to keep, like this structure. But John mentioned something very important, it's like the mindset. Mm-hmm. What we noticed, because we were in this mode of working from home for so long, 4 years since COVID started, people actually used to go to the office because they were told to go to the office, and they would stay there in an individual room in Zoom meetings all day. So what's the point of being in the office, right? So I think what we're starting to do now with this new approach is really think about intentionally creating moments that matters. So employee experience. So employees can be in the office and they can actually have those moments of creativity, conversation, building networking. I think that's one of the considerations that I would put here. So really key to have that flexibility. But if you are in the office, try to spend time with your team. So it's also education to leaders to change that mindset. It's not just being in front of you, but it's really creating that connection and belonging.
Great, great. Thank you. So, one of the things that I think you kind of naturally leading into was this talking about the mind frame of, and you were both talking about making a comfortable space for people to come in and interact. And but so, another aspect of creating a workplace that values well-being for everyone is certainly healthcare, health benefits, mental health. That is being talked about a lot more now. And Vitor, not to put you on the spot again, but I know that you mentioned a really interesting program that you all have been doing with the mental health champions.
Yeah.
And can you talk a little bit about that? And then it's open field. Maybe one more of you can just add your thoughts on just mental health in the workplace.
Yeah. So our diversity inclusivity team actually started, officially maybe 6 or 8 years ago, right? And we started with the focus of implementing ERGs. So that was the first topic. But then we expanded to include diversity, inclusion, and also well-being. Under the well-being, we actually implemented a program that was designed with a company from the UK. And basically that program is to have mental health in the organization. So any person can volunteer, say, I want to be a volunteer to become a mental health champion. And this program has today 500 mental health champions, over 130 different countries. So we do have representation from, every type of background, people with different, languages, different locations. So they can actually be that person. And basically, they go through a training. It's like a 1-week training where they get, kind of this certification on being a mental health. It's provided by, psychologists, therapists, and etc. And basically, their role is, okay, if someone is struggling with something and they don't have anyone to talk about, and that's very common if you only work from home, right? You just have your family, no one else. So how can we, as volunteers, actually be a guidepost? That's the key word, is a guidepost. We're not meant to replace therapy or professional counselors. It's more like being volunteers and say hey, maybe you should connect with our EAP program and talk with a therapist or something like that. So those are some of the areas that I would say it's being very successful. We have a lot of volunteers, and it's basically you can just sign up, and that helps you as well as an employee to be more engaged.
Great. Yeah. And how many ambassadors do you have for mental health? How many people have?
So right now it's around 500.
Wow.
Yeah.
Great.
Globally, Philips has 67,000 employees. So 500 is not a lot, but it is a start.
Yeah. Awesome. I'm actually just going to go ahead and skip forward because I want to make sure that we talk to you, Vaughn, because you occupy a unique space among the panelists in that you are focused specifically on health issues that impact women. And I was thinking about this, and just anecdotally, I have noticed that perimenopause, menopause, these are things that historically, unfortunately, just have really not been talked about very much in terms of how it impacts women in the workplace. Also things like women going back to work if they've taken some time off to focus on their family or whatever. And so just things that specifically impact women and employees. Can you talk a little bit about just what are some of your key issues that you're working through, and what kinds of support do you think workplaces should offer when it comes to understanding women and the health challenges they're facing?
Yeah, thank you for this question. I have my notes, I'm going to cheat too. But just so that you know, Ovia Health offers our services, that women's health services, to employers, and then employers offer the Ovia to your employees as a benefit. So we meet, speak with, connect with, and coach thousands of your employees yearly. We've been in business now since 2012. We've worked with over 22 million family journeys. So we have lots of data to support and suggest what we feel are our right approaches, not only from our perspective, but also from your lens as an employer, because we work with you as our clients. And one of the things that we've learned, obviously, is creating that really space for awareness and education. So foundational to our program is an educational aspect. So we provide articles and information and videos. The members have access to health coaches that can help coach them through their women's health journey, whether it's pregnancy or postpartum, or if it's menopause. So really creating that awareness and education. And then also dedicated support resources. Many of you have already shared that as you talked about how you can really empower your employees to seek guidance as it relates to mental health as well. Mental health is so important. We survey the employees. There were 9 elements that they called out as areas of gap in terms of needs from their employers, and mental health was number 3. Number 1, actually, and this was a survey amongst, I believe it was about 2,000 employees. Number 1 was actually parenting programs. Number 2 was flexibility and schedule. And there were many variances under that. So really interesting to see how they view their benefits and whether or not they're meeting their needs. Also return to work programs, and we've talked about that a little bit, and that can come, in many forms or fashion depending upon who your audience is with your employers. But we do work very closely with partners to help create return to work programs to really provide space for employees to receive that necessary guidance and care to prepare themselves to return back to work. And then also feedback. So important, giving them the opportunity to speak into their employer to talk about what their needs and gaps are as it relates to their women's health journey. So I think those 4 are probably the top 4 we talk about approaches.
Great. Thank you. Thank you for sharing those, especially the employee feedback, because that leads me to my next question, which I'm going to throw out. And maybe we can start with you, Jan, but just around how do we approach measuring buy-in and participation in these various wellness initiatives? The success, how do we measure that?
So we're measuring stuff that they don't know we're measuring. So we have, right now, this is our most fun month, right? My team is right over here. It's a very labor-intensive month where we ask employees to tell us who's awesome that they work with, and they can nominate up to 2 coworkers. And then the person who did the nominating, the person who was nominated, all go into a drawing for prizes. But if you get nominated and someone says you're awesome, you get in the mail a mug that says awesome on it. We've done them with little poems, we've done little sayings, but people have now a collection of their 8 mugs. I've been there 10 years. This is the 9th mug that says they're awesome, that another employee has reached out and said they're awesome. Well, we're measuring how many people at each station are participating. When we would buy a new TV station, part of our onboarding is to promote our nonprofit. So we have employees donate, company matches, and when an employee has a catastrophic unforeseen event, we have a financial fund to provide them with a grant to at least help them financially. So that's part of the paperwork. Are you willing to give $1 a paycheck to Focus on Caring? See Focus TV? I have a writer. And it's been interesting when we buy a station, if they're excited about being sold to Gray Television, because we are the best one in our space, then a lot of people donate. But when they're scared of coming up to a big corporation because they've been a family-owned TV station for 60 years, and what are we going to do coming in? No one donates. And so I look at those numbers when we buy the stations and go, okay, and now I know it's kind of a gauge of how they feel about this transaction and maybe how much work we have to do to win them back. And those ones that had a 0, I'll tell you the station name later, you guys. Go back and do a campaign and see if they engage later. Have they bought in? Did we win them over yet? Are they ready to be a part of this and believe we care about them? And those measures tell us things. We have a drinking water challenge. We measure how many people participate in that. So we look at how many people sign the Safe Driving Pledge. We have a different theme every month. that we have a little fun with. And so it's not a formal survey. It's not, hey, are you engaged? It's looking at engagement and looking at, if it has a low number, it doesn't necessarily mean folks are engaged. Their local culture may really be on top of that, and that's cool. But sometimes it can give us information like, what's going on there? Why didn't no one do this? When other stations are excited about it, enjoying it. So we try to dig in that way.
Awesome. Well, you actually touched on a really important factor, I think, to employee well-being. I think we would all agree, which is, financial stability and resources. Not just a paycheck, but there's some other innovative approaches that you all have talked about. And so I want to turn it over to Kayling for you to talk a little bit more about TapCheck. You mentioned a really interesting stat, which is that 70% of the American workforce lives paycheck to paycheck, which is pretty stunning. And so talk a little bit more about just the unique insights that you have about why paycheck flexibility is so crucial in some cases, and just how you all are approaching this issue of when employees are paid.
Yeah, I think it's pretty astonishing, the number of the American workforce that is living paycheck to paycheck. But on top of that, over 14% of Americans are underbanked, which means they don't have access to traditional credit or finance that we might have the opportunity to. And so those unexpected expenses that come up, like a flat tire or your child gets sick. We were at Disney World a couple of weeks ago for the New Year's, and my kids all got the flu and we had to go to urgent care, $100 for Tamiflu because they wouldn't take insurance. That is sometimes the thoughts that a lot of employees have to go through. And so payroll.org did a survey that says about $500 billion of loss goes towards employee financial struggles. And that shows up through absenteeism, lost productivity, right? I'm gonna not be focused at the job if I'm trying to figure out how am I gonna pay to patch that tire that I got on the way to work, or turnover. And so definitely something worthwhile and worth our attention. At TapCheck, we feel that financial stress, right, that stress that hits our wallets, trickles down to that stress that impacts our hearts and our minds, which then trickles down to that stress on our physical wellness. And so it's all very interconnected and could go down or back up. And so really thoughtful programs on giving employees access, and also that is budget friendly. And so products or benefits like TapCheck, which is earned wage access, is free for employers to implement, and employees only pay a small, like out-of-network ATM type of fee when they choose to get paid on demand. It's really kind of creating a win-win. We integrate with the company's existing payroll and time clock systems, so employees are only accessing the earnings that they've already worked. And so that also helps them to manage their budget within their means. We're not extending additional credit, or they're getting looped into those vicious cycles. And so really kind of creating approaches that are also driving to solutions that really keep employees feeling supported by their employer, but being able to overcome those financial obstacles when they come awry. And so we really focus with a lot of employers. You'd be surprised, because I think we were talking, Jan, that she implemented an earned wage access solution, even in the broadcast, but it is quite a variety of industries that are starting to adopt pay on demand benefits. So think about hospitality, think about healthcare, restaurant space, retail. It's kind of becoming a lot more well known, and will soon to be table stakes as part of benefit packages, and really helping employees manage that financial stress without putting significant burden on your budget of how to add additional benefits.
Great.
I'm a big fan of earned wage access. I took about 2 years reading everything I possibly could about earned wage access and the IRS and the Treasury Department and all the different rules and regulations, and talk to this vendor and that vendor and that vendor. It took about 2 years. I think if I had an HR crystal ball, I think this is what's going to be expected of all of us. Right? It's a gig economy. People can drive an Uber for an hour, download their cash, get gas money to keep driving all day. So having that kind of flexibility and urgent access to their earnings, I just think they're going to start to expect from us. So we just want to get in front of it. And this is a really easy yes for the executive team, because like you said, it didn't cost us anything to put in. We made sure, and I don't know if you have this, I don't want this to be a gotcha, but I bet it's not. One thing that was really important to us is I didn't want our employees to have to pay a fee every single time they got their money. So into our contract is, if you go to download some money and you get it the next day, no fee. If you need it urgently, then you pay the ATM fee.
Yep.
But the next day it's going to be free. So they have more flexibility without a fee, and I needed that baked into the contract for eternity, and that couldn't change because I don't want to introduce a way to pay people that also cost them. So, but that urgent access, yeah, you got to make money somehow, but it's just a low ATM fee. I'm a big fan. If anyone wants to talk about it, I'll stand behind her. I don't do business with Haling's company, but I'm a big fan. I think we should all do it.
I have a follow-up question.
I'm a big fan of the family journey stuff too, by the way.
How does, and this, anybody can jump in, but how does pay equity figure into the financial well-being conversation?
I mean, I have some thoughts just from the different questions that we get from the many businesses that we partner with, which is, even when you think about moving to direct deposit as an example, right, and trying to get more and more employees plugged into that. But there's a lot of employees that simply don't have access necessarily to bank accounts, right? We have about 5% of the population is unbanked completely. And so we are wrapping up solutions like pay cards and being able to have 100% availability to bring these employees to the banking system, but in a very low way that is approachable for them. And so even solutions to think about that when you're implementing a lot of your pay and HR benefits, you kind of have to think about the broad spectrum, because sometimes you have your biases or you have your assumptions, but if you kind of walk a mile in some of these employees' feet, there's a lot of different options that you have to think through.
Thank you. Tiffany, I want to make sure that we come over to you to talk a little bit about a totally different topic in a lot of ways, but touches on everything, I'm sure. So just the latest advancements in technology as it's being used to enhance well-being. I know that it's kind of at the tip of everyone's tongue these days, but it's almost like AI is not even a term that means anything anymore because it just gets thrown around all the time. But AI is here. And so what are some of the ways that you've found to responsibly leverage technology and also make sure that things like AI are not getting in the way of employee well-being?
Yeah, I think technology touches on the three themes that we've heard on this panel. We talked about education, right? So you can leverage technology to be able to educate your people. Access, right? We talked about the mobile app, right? That's all driven by technology to be able to give people direct access to the information that they need when they need it. And then data, right? So that's the biggest thing, is you can leverage technology to be able to touch on all those different data inflection points to be able to get the information that you need to your people. One of the things that we've done at S&P Global is that we've heard that we have a lot of benefit offerings. We offer menopause, we offer financial support, we have a great leave policies. But we heard from our people is, but you have so much information, we don't know where to find it. And so what we've done is we have a bot that's in beta, and we've put all of our benefit information in that bot, and it's powered by generative AI, and it's to make people be able to get the information that they need when they need it, right? And digestible as well, right? That's the biggest thing as well, is like when you get into these policies, sometimes they're very HR language driven, very legal driven. And so they're not actually able to interpret it. What does this mean for me? So we've been able to leverage that bot to be able to say, what does this mean for you? And then how do we do it responsibly is we still have a human behind the scenes reviewing all the different questions that come in, doing a risk assessment on how the bot answers the question, and then continuously learning and training the bot to make sure that we're giving the people the information that we need. We also make sure that we point them back to the policy in the bot as well. So the bot will give a generative AI response, but there's a link to the actual policy so that we can make sure that even if the bot gives a hallucination, they're all actually getting a link to the actual policy to get the information. So I think technology is going to drive a lot that we see in the well-being space, especially when you look at those 3 points about how do you educate, right? How do you give people direct access? And then how do you use that data to be able to drive the different decisions that you make as an organization?
Great follow-up question to that. Since you mentioned, that it's important, it's great to have all these tools, but at the end of the day, you also need some human oversight of those things. So how are you making sure that the humans that are managing these different tools are trained and are, using them in the way that supports the overall vision for moving these.
Yeah, so our biggest tagline, so people technology sits in my remit, is how do we augment human capability with technology,
yes.
right? So that's really key, is that you're augmenting, right? You're not taking away, you're not displacing. So with our beta bot, we did a lot of testing, right? So we tested with our people services team who handles all of the initial point of contacts for the people, processes, policies, and questions. They know how people ask questions, right? So they made sure that they trained the bot on the way that people ask questions. We actually took questions from our cases and said, throw it in the bot and see how the bot responds. We created, in combination with our legal team, and we have an AI council as well at S&P Global, is we created a risk assessment, right? What are the risks that we're okay with? What are the risks that we are not okay with, right? And then again, we have a knowledge team that sits in my space, and their primary responsibility is governing all of the policies, right? So making sure they're written in a way that's standardized and streamlined. They're also the ones that are behind the scenes reviewing all of the bot questions. And then immediately we see something that's a red flag, we pull that question out. We work very closely with the technology team that sits in my remit to be able to say, how do we retrain the bot, right? And I think that's the biggest important, is that you have to constantly train the bot. You constantly have to have that information, because AI is nothing without the data, right? And so making sure that our data set is as clean as possible, that's one of the things that we've done to make sure that we're using AI responsibly. And then we also just took a risk assessment of like, what policies are we okay with putting in the bot versus, and using generative AI. And that's a big thing too, is there's different types of AI that you can use. Mm-hmm. So we've trained our bot, okay, these questions can be answered through generative AI. These questions have to be answered through traditional AI, where it gives a standard format.
Mm-hmm.
Very interesting, thank you. This is about a different kind of risk assessment, and really it's open. I'm not going to call on any one specific person, because I think this applies to us all, but for those of you that are based in Atlanta, as you know, over the last couple of weeks, we have had some very unusual weather. We've had multiple inches of snow, we've had ice, we've had some cases, closings that were announced the day before. And a lot of this is really sort of reflective of our new reality in the face of climate change. And so I was really curious to get your thoughts on, because, we saw again last week that there were some employees that, went out in the morning to go to work and then got stranded on the road. And it wasn't quite as bad as the first snowpocalypse 10 years ago. But, so in the face of these increasingly unpredictable weather patterns and severe weather and the possibility of emergency crisis situations coming up, I would love to hear from several of you just on how you're helping to prepare yourselves to be able to be there to support your teams.
Jennifer Valdez, CBS WANF, is your new favorite meteorologist. She nailed those two storms. I think if someone feels like they have to come to work when it's not safe, you have a broken culture, right? Everyone at work is an adult, so they should be able to make their own decisions about their safety. And if they're not empowered to make that decision and have to go into work when they're sick, or when it's icy, or when it's any one of a number of reasons where they just don't need to go into work, they have to be empowered and not feel like they're going to be hurt or talked to or judged for not coming in. Our head of benefits is not here today. He wanted to come here and support me because I'm a nice lady, and but he had other things that were just more important, and it was easy for him to say, hey, I'm not going to make it. And he's not going to be in trouble. I messaged him and said, are you okay? That's what your culture should be, because we're adults and we have to treat each other like adults. And when people are like, no, I have to get on the road and go in, when you shouldn't be, it's broken. It's just broken.
Yeah. I think in addition, I think it's also looking at your benefit offerings, right? So we have an S&P Global Foundation, right? So with the wildfires, we did have employees that were impacted in California, right? So we were able to offer financial support through our S&P Global Foundation. One of the things we also did is look at your 401k policies, right? So there is a FEMA disaster relief type of hardship withdrawal that you can offer through your 401k, so that people can be able to, pull out from their 401k to get the monies that they need to be able to support them financially. So I think it's also looking at your financial support policies that you offer, in addition to culture, right? Making people feel comfortable. And with a combination of those two things, I think that's what you have to do to be able to support your people.
Yeah. I would add to that also. One part is having to learn with the crisis that we had with COVID. So back then we had crisis teams. We had, crisis councils in every company. So now even if we have a situation like this, right, just put that team together, right? I think that's one part that even if you have a broken culture, if there is like sponsor from the executive level, like, hey, we're closing this location today because it's not safe. Like that's regardless of a manager. So sometimes I think, the approach is like you need to actually be more directive and prescriptive in that type of sense to really ensure that the safety of all the employees. And that goes also in manager training, manager education. So I think, there is benefits, there is, mindset in culture, but also like we need to have, as HR, this head of like, hey, we need to close the location. Crisis team, let's get together and find a solution.
Great.
I mentioned, I think the foundation's really important. Yeah. You don't have to be S&P to have a nonprofit foundation to help employees. We started ours when we had about 1,200 employees. We have 10,000 now. It was 10 years ago. But it doesn't have to be a giant company to be able to offer things. Yeah. There are things that we can do because you want to do them. They don't necessarily need to have a big budget for them. You need to have a budget for a family journey, and you should. Earned wage access is free. We keep looking for the next thing, but some things we do don't cost anything and can actually save us money.
Yeah. I actually, so I was saving that sort of the best for last, but and we'll circle back to that. But Kayleen, I know that you were looked like you were going to say something about the crisis planning.
Yeah. Well, we partnered with a lot of our employers during the different weather events that were happening, and that's where employers, while it wasn't sponsored, they sponsored the program for a couple of transactions, so that employees who didn't have emergency funds could go out and kind of prepare for some of these snowstorms. I'm from Dallas. We closed down for 2 entire days. Like literally nobody was on so nobody knew how to drive. But a lot of employees, that's pretty stressful when you don't maybe have extra stuff in your pantry to hold your families over because schools were closed. And so employers were able to send out notifications to their employees and say, hey, you have access to this. If you need to grab a couple of things, and we're just like a weight of relief on a lot of our employees that we support, and really at very, very low cost.
Great. So to circle back on the question of, there are a lot of, I'm sure, very different size companies and organizations represented here. And so can you talk a little bit about, I love, Jan, that you kick things off with you don't necessarily need a massive budget to kick all of these things off the ground, but what are some...
it helps.
Yeah, it never hurts. What are some of what recommendations as we close in the last 3 minutes that you recommend for organizations that may have varying levels of resources and staff and bandwidth?
I'll say use the data, right? Use data and dialogue to drive what you should prioritize, right? So it's not about the size, it's about what do your employees want, and different employees need different things. So I'm an advocate of using data and dialogue to really drive what you need to prioritize and what you need to deliver to your employees. Yeah.
I think communication, education. I think a lot of companies have great benefits. Employees have no idea what's available to them. And especially if you have a workforce that you can't email. Look, even if you email them, we say, just because we told them doesn't mean they know. Sending an email is just not enough. So being creative in the way that you communicate with people so they know there's an EAP. You can get 5 in-person counseling sessions in your neighborhood. Here's how you reach out to employee relations if your workplace is not safe for you. And making sure that information is constantly out there, because you can have all these great benefits, but if they don't know about them, you're just not that great of an employer. Even if they don't need any of them, I think it feels good to go to an employer that, I'm not going to have any more babies, but if I went to look for another job, I'd be pleased to see that there was support for reproductive health at an employer I went to. So the messaging isn't just for the people using the benefit, it's for everybody to know that you've taken the care to have inclusive benefits that affect a lot of different people.
Great, thank you. And Vaughn, I just want to turn back to you sort of to close us out. If you have any, I love the communication piece, and I know that you had some interesting thoughts on that, so just close us out.
Yeah, I was actually gonna piggyback and on what they were saying and share that use your partners. So you have these amazing partners who have data for you to help you with your informed decisions around where the gaps are with your employees. So use your partners for that. We have a ton of data that we share with our employer partners monthly to let you know what we're hearing from your employees and what we're seeing as trends as well across the market. We also work with health plans. So we're hearing directly from health plans what the trends are there as well and are sharing that with our employer partners. So I would say working really closely with your partners is super, super important in that.
Perfect. Thank you. Well, with 20 seconds to spare, this doom clock has been ticking down this whole time. So thank you all so much for attending. Thank you so much to these panelists for just sharing your wisdom, and really appreciated being here with you today. Thank you.
Thank you.